Hi, my name is Fran and I'm a cardiac rehabilitation nurse. This is a talk about how what you believe about your heart health can affect your recovery after a cardiac event. People with coronary artery disease can hold specific beliefs about what caused the disease and what they should do to cope with it. But some of these beliefs are misconceptions, or what you might like to refer to as faulty thinking or misbeliefs. These misbeliefs can lead to coping behaviours that could adversely affect how you recover from your cardiac event and how you may feel, your everyday activities, your quality of life and your long-term health. These beliefs can be frightening and unhelpful for you and the people around you. Researchers found that misbeliefs can be reinforced by health professionals, your family, your friends, and even in the media, such as television programmes, newspapers, and the radio. Here is a real example of how misbeliefs can affect recovery. So Michael and Paul were in hospital together and they both had heart attacks. Michael had a positive experience in hospital and felt that everything had been explained clearly to him, and he felt listened to and supported by the doctor, nurses and the cardiac rehabilitation team. He was discharged with a clear plan for recovery and further cardiac rehabilitation input. He attended the cardiac rehabilitation classes and made a good recovery. He returned to work whilst continuing to exercise regularly. He was able to talk to his family about how he was feeling and felt well supported. He had no symptoms and was not admitted to hospital with further symptoms. And for him, life was good. Paul, on the other hand, had a bad experience in hospital. He felt that his questions were not answered in a way that he could understand, and he was not informed of his diagnosis or the results of tests or what to expect on discharge, which made him feel anxious and lacking confidence and depressed. He was not seen by the cardiac rehabilitation team whilst in hospital. As a result, he felt anxious and stressed and unable to return to work. He did not feel confident to exercise and started to comfort eat. He started to get chest pain and was frequently admitted to hospital. He felt unable to talk to his family because he felt they would not understand, and for him, life was bad. This is a clear example of how beliefs can be formed and how they affect the person and their recovery. Researchers at York University found that among patients who've had heart attacks, those who had higher numbers of misbeliefs suffered with undue anxiety, emotional distress and ill health. They were less likely to believe that they had any control over their illness. They also felt less healthy and had a slower recovery, and they had poor attendance at cardiac rehabilitation classes. They also were less likely to return to work and had a greater number of admissions to hospital. In other research, those who had angina and a greater number of misbeliefs were more anxious, depressed, and physically limited. In this research, it was recognised that health professionals did not correct patients' misconceptions, perhaps as a result of not having had time to spend with patients due to the pressures in the NHS. Researchers looked at ways in which to help health professionals check patients' understanding in order to dispel incorrect thinking and provide patients with targeted, accurate education about their heart health and recovery post-cardiac event. A questionnaire from patient interviews called the York Cardiac Beliefs Questionnaire was devised and can be used with patients to find out what their beliefs are and provide them with the correct answers. Here are some examples of the statements from the interviews with patients. What do you think about these? The first one, heart problems are a sign that you have a worn-out heart. Actually, the truth is your heart doesn't wear out. You can make it stronger by being more active. And what about this one? Rest is the best medicine for heart conditions. No, the truth is that rest is not a medicine, and in fact too much rest makes your heart unfit, leads to a lack of energy and stamina, which can cause more problems. And this one, people with coronary artery disease should take life easy. No, the truth is that you should have as active a life as you can. It will help prevent more problems in the future. Imagine the effect on your recovery if you believe these to be true. You could be worried that your heart's not working properly and it's likely to fail and that you need to rest, all of which would have a detrimental effect on your overall recovery and your heart health. Here are a few more statements from the questionnaire. A heart attack makes a weak area in the heart wall that can easily rupture. The truth is no. The scar tissue which forms after a heart attack is actually quite strong and very unlikely to cause any problems. What about this one? Once you've had one heart attack, you're bound to have another one. The truth is, no. Most people who have one heart attack never have another, particularly if they change their unhealthy lifestyles. What about this one? Angina is a kind of heart attack. No, it's very different. Angina is a symptom caused by narrowed coronary arteries, which feed blood to the heart muscle, reducing the blood flow to the heart. Angina is a warning that your heart muscle is temporarily not receiving enough oxygen, for example during exercise or during in extreme temperatures, but does not damage the heart muscle. A heart attack, on the other hand, is a medical emergency. It is caused when one of the coronary arteries blocks, which means that part of the heart muscle will be starved of blood and will become damaged. It is essential that the person gets to the hospital as quickly as possible to have the artery opened to restore blood flow to the heart muscle and to reduce the amount of damage to the heart muscle. Here's another statement. Coronary artery disease is often caused by people's lifestyle. This is true. An unhealthy lifestyle is the main cause of coronary artery disease. This slide shows all of the risk factors for coronary artery disease. Risk factors are conditions or habits that increase your risk of developing coronary artery disease. The good news is many heart and circulatory diseases are caused by risk factors that can be controlled, treated or modified. So let's go through each image on the slide. So the first image is of the potato lying on the sofa. So that represents physical inactivity. Being physically inactive or sedentary can lead to heart and circulatory diseases like heart attacks and strokes. Physical inactivity or being sedentary is when you don't move your body for long periods of time. This can include sitting or lying on the sofa, watching TV, and sitting at a desk or computer. Being physically active doesn't mean you need to join a gym or run a marathon. It can include things like housework and gardening. It's all about getting up and moving more. Being inactive can lead to fatty material building up in your arteries, the blood vessels that carry blood to your organs. If the arteries that carry blood to your heart get damaged and clogged, it can lead to a heart attack. If this happens in the arteries that carry blood to your brain, it can lead to a stroke. The good news is there are many ways to reduce the risk of this happening. So why should you be more active? The heart's a muscle, and like any other muscle, it needs physical activity or exercise to help it work properly. When you're active, your lungs do a better job of getting oxygen into your blood, so it can be pumped to all the tissues and cells of your body. Being active can reduce your risk of developing heart and circulatory diseases by as much as 35%. Regular physical activity helps control your blood pressure and keep it within healthy levels, raises your levels of good cholesterol and reduces the bad cholesterol, can help to control your blood glucose levels, reducing your risk of type 2 diabetes, and increases the number of calories you burn and helps you maintain a healthy weight. Not only does regular activity protect your heart, it can also help your general well-being by boosting your mood, improving your concentration and memory, and helping you sleep better. So how active should you be? So you need to be active every day. You don't need to do specific exercise or take up a sport. You can go for a walk, mow the lawn, vacuum, or dance along to music. Any activity is better than none, and you should try to break up long periods of inactivity like sitting or lying down. When you're watching TV, get up and walk around during the ad breaks. Aim to do at least 150 minutes of moderate intensity activity per week. This is anything that raises your heart rate and makes you breathe faster and feel warmer, like brisk walking or cycling. You can spread out the 150 minutes over the week. You can even do short bursts of activity. Every minute counts. You should also aim to do muscle strengthening activities like using hand weights, climbing the stairs, gardening, such as digging or carrying heavy shopping, on at least 2 days a week. So the next image is of a person smoking. So smokers are almost twice as likely to have a heart attack compared to people who have never smoked. Smoking is very harmful to your heart. It seriously increases your risk of developing heart and circulatory diseases. To keep your heart healthy, you can make small lifestyle changes to help you quit smoking. The chemicals in cigarettes make the walls of your arteries sticky. This causes fatty material to stick to the walls. The fatty material can begin to clog your arteries and reduce the space for blood to flow properly. If the arteries that carry blood to your heart get clogged, it can lead to a heart attack. If the arteries that carry blood to your brain get clogged, it can lead to a stroke. Smoking can also affect your heart and blood vessels by increasing your risk of blood clots, causing an instant rise to your heart rate, causing an instant rise to your blood pressure, and reducing the amount of oxygen delivered to the rest of your body. So the benefits of quitting smoking are your heart rate and blood pressure will begin to return to normal after 20 minutes. Your sense of smell and taste will begin to improve after 2 to 3 days. Your breathing will begin to improve, and exercise may be easier after 2 to 12 weeks. Your risk of a heart attack is half of that of a smoker after 1 year. And quitting smoking also has other benefits, like you will have fresher breath and whiter teeth. Your skin might look younger and age less quickly. You might have more energy, feel less tired and get less headaches. Your immune system will find it easier to fight off colds and flu. Your sex drive may increase and it can improve your fertility. And you'll protect the health of your children, your family and your friends. It's never too late to benefit from stopping smoking. On average, men will add 10 years to their life if they quit by the age of 30. Many people will add 3 years to their life if they quit by the age of 60. Being a non-smoker can also improve your chances of being more physically active and healthier as you get older. Next picture is someone having their blood pressure taken. So this is to represent high blood pressure. The medical term for high blood pressure is hypertension. So what is high blood pressure? Your heart pumps blood around your body to deliver oxygen and nutrients to your organs. Your blood pressure is the force your heart uses to pump blood around your body through your arteries. Your blood pressure naturally goes up and down, and it's fine for it to go up while you're moving around. It is when your overall blood pressure is high, even when you're resting, that you need to do something about it. So how is it measured? When you have your blood pressure measured, your reading is written as 2 numbers. The first is when the pressure is at its highest, or systolic pressure, which is when your heart beats. And the second number is at its lowest, or diastolic pressure, which is when your heart relaxes in between beats. Your blood pressure should be less than 130/80 millimeters of mercury if you have coronary artery disease. High blood pressure can cause heart and circulatory diseases, including heart attack or stroke. Most people get high blood pressure because of their diet, lifestyle, or because they have a medical condition. Drinking too much alcohol, smoking, being overweight, not doing enough exercise, and eating too much salty food are some of the causes. Sometimes high blood pressure runs in families and also can worsen with age. It's also more common if you are of Black, African, or Black Caribbean descent. However, even in these cases, you can still improve your blood pressure by changing your diet, losing weight, stopping smoking, reducing your alcohol intake, and being more active and taking medication. The next picture shows how cholesterol can build up in the arteries, especially when you have high cholesterol. Cholesterol is a natural fatty substance in your blood. It's produced in the liver and it's also in some of the foods we eat. Cholesterol is important to keep the cells in our bodies healthy. High cholesterol means that you have too much cholesterol in your blood. There are many things that can cause this. If you don't take steps to lower high cholesterol, it can increase your risk of heart attack and stroke. Anyone can develop high cholesterol. It can be caused by many different things. Some you can control and others you can't. Things that cause high cholesterol which you can control are eating too much saturated fat. This reduces the liver's ability to remove cholesterol, so it builds up in the blood. Being physically inactive. Being active raises the level of good cholesterol and reduces the level of bad cholesterol. And smoking. This can lead to high cholesterol levels and it causes tar to build up in your arteries, making it easier for cholesterol to stick to your artery walls. Things that cause high cholesterol which you can't control are, as we get older, having cholesterol is more likely as we age. If you are male, males are more likely to have high cholesterol, and your ethnic background. If you're from a South Asian background, you're more likely to have high cholesterol. Genes carry the information that determines your features or characteristics that are passed on to you or inherited from your parents. Familial hypercholesterolemia, or FH, is an inherited condition, meaning you were born with it. It's often passed down through families in faulty genes and can lead to very high cholesterol levels, even if you don't have other risk factors. Cholesterol is used by all the cells in your body to keep them healthy. It's carried around your body to the cells that need it by proteins in your blood. Proteins are substances in your body that do most of the work in your cells and help keep your body's tissues and organs working as they should. When cholesterol and proteins combine, they're called lipoproteins. There are two main types of lipoproteins. One is good for your health, the other is bad. High-density lipoproteins, or HDL, is known as good cholesterol. It gets rid of the bad cholesterol from your blood by taking cholesterol you don't need back to the liver, where it's broken down and removed from your body. Non-high-density lipoproteins, or non-HDL, is known as bad cholesterol. You may have heard it called LDL cholesterol. Too much LDL leads to a build-up of fatty deposits inside the walls of the blood vessels, the channels that carry blood throughout your heart or your body. This builds up and narrows blood vessels, increasing the risk of heart attack or stroke. There are usually no symptoms of high cholesterol, but if left untreated, it can lead to heart attack and stroke. It's often a hidden risk factor, which means it can happen without us knowing until it's too late. That is why it's important to get your cholesterol level checked. You can ask your GP to check your cholesterol levels, which are measured using a simple blood test. It's sometimes referred to as a lipid profile. Your GP or practice nurse will take a blood sample to check for the following: levels of good cholesterol, HDL, levels of bad cholesterol, LDL, and triglycerides. You'll also get a total cholesterol result. A normal cholesterol level for someone who's had a heart attack is below 4 millimoles per litre. There are lots of ways to help you lower your cholesterol. You can try ways of getting more active, which will help lower your cholesterol, but also help you sleep better and feel more energetic. You can cut down on alcohol and stop smoking, and you can enjoy trying healthy foods and recipes that are good for your heart. However, if lifestyle changes are not enough to lower your high cholesterol, your doctor may suggest medication. If you are diagnosed with high cholesterol, your GP should invite you for a blood test every year to check your levels and adjust your treatment if necessary. Statins are the main type of medicines used to reduce cholesterol, but there are other treatments available. Your doctor will let you know if you need to take any other drugs which help control your cholesterol levels. They may also refer you to a specialist called a lipidologist. So the next picture you can see is of some donuts. So this is to represent saturated fat. So it's not always clear what we should or shouldn't be eating to improve our heart health, especially when it comes to fats. Despite what you read in the media, our advice is clear. Replace saturated fats, like these donuts, with unsaturated fats and avoid trans fats. Saturated fat is the kind of fat found in butter, lard, ghee, fatty meats and cheese. Eating a diet high in saturated fat is associated with raised levels of non-HDL or bad cholesterol. This is linked to an increased risk of heart and circulatory disease. That's why official recommendations emphasise the importance of reducing saturated fat in our diets. But just replacing saturated fat with refined carbohydrates like sugary foods and drinks won't improve your health. Replacing it with unsaturated fats such as oily fish, nuts or vegetable oils like rapeseed or sunflower oil does seem to reduce your risk of heart attack and stroke. Remember though, all types of fat are high in calories, so eating too much can lead to weight gain. Being overweight or obese is a risk factor for heart and circulatory disease and many other diseases. Vegetable oils are the healthy choice for frying and baking, and plant-based spreads, avocados or nut butters for sandwiches, toast and potatoes. These are healthier choices than butter or lard. Check food labels and compare the fat content in different products to help you choose ones that are lower in saturated fat. But remember, while this will help to lower your cholesterol level, we need to look at our whole diet to reduce overall risk. Many factors affect heart disease risk, not one food or nutrient alone. The Mediterranean diet is associated with reducing your risk of heart and circulatory disease. It includes plenty of fruit, vegetables, pulses, fish, nuts, seeds, and less butter, meat, full-fat dairy products and high-fat snacks. So it's naturally higher in unsaturated fats and lower in saturated fats. So foods that are included in high saturated fat, sugary and salty foods such as cakes, biscuits, chocolate, crisps and ketchup are what we consider to be non-essential parts of your diet and don't need to be included as part of our regular eating pattern. However, it's not positive to say that they shouldn't be eaten or that these foods are bad or dirty. While these foods may not be needed by our bodies for good health, they are foods that we enjoy and play a part in the pleasure and social aspects of eating. So when you do eat them, it's not a cheat or something you need to feel guilty about. The moderate approach to eating might not feel extreme enough to make a difference, but consistency is what matters when it comes to your diet. Small changes can add up to make a big difference over time. Allowing yourself greater freedom to accommodate your tastes and your lifestyle when you choose your meals is likely to be more successful over the longer term. Focus on the food groups you need to be eating more of and achieving a healthy balance, but give yourself the flexibility to include all foods. The next picture shows somebody checking their blood sugars. Diabetes is a lifelong condition that causes your blood sugar levels to become too high. Sugar in the blood is also known as glucose. It's your body's main source of energy. It comes from the food you eat, particularly carbohydrates like bread and potatoes. Glucose is carried through the bloodstream to cells around the body to give them energy to work. When there's glucose in the bloodstream, the pancreas, an organ near the stomach, makes a hormone, which is a chemical messenger called insulin. Insulin tells the body's cells to absorb the glucose and use it as energy. In somebody with diabetes, their body can't absorb glucose because there's a problem with their insulin. This means their cells don't use the glucose for energy. The unused glucose stays in their blood and builds up. The excess glucose can damage their arteries. Arteries carry oxygen-rich blood and nutrients around the body. If their arteries are damaged, it can increase the risk of developing heart and circulatory diseases. So if you are diabetic, the good news is you can reduce your risk of having a heart attack or developing heart disease. And the way to do that is to have your HbA1c, your blood pressure and your blood cholesterol measured at least once a year as part of your annual diabetes review. And at the same time, make sure you get advice and support from your healthcare team to help them within your target range. Get help to stop smoking, eat a healthy, balanced diet to protect your heart, be physically active, lose weight if you are overweight, and take your medication as prescribed. The next picture shows some white powder and a leaf. So this is to represent cocaine and cannabis. So illegal drugs and so-called legal highs can have dangerous effects on your heart and body. And if you're on medication, drugs can interact with these and cause damage. So it's important to know what they can do to your heart so you can make sensible decisions. So there are several drugs that can put a strain on your heart, causing irregular heartbeats, heart attacks and strokes. And that includes cocaine, cannabis, amphetamines, ketamine and LSD. Some drugs can also reduce your heart rate and blood pressure, such as heroin, and some drugs can increase your risk of pulmonary edema when fluid flows back into your lungs, causing extreme shortness of breath, and they are amphetamines and heroin. So the advice is that legal highs can cause many of the effects already described, and just because they're not illegal doesn't mean they're not dangerous. All drugs have many other side effects and affect everybody differently. If you have a heart condition, make sure you support your health by avoiding illegal drugs, legal highs and any form of smoking. Next picture is someone having their blood pressure taken. So this is to represent high blood pressure. The medical term for high blood pressure is hypertension. So what is high blood pressure? Your heart pumps blood around your body to deliver oxygen and nutrients to your organs. Your blood pressure is the force your heart uses to pump blood around your body through your arteries. Your blood pressure naturally goes up and down, and it's fine for it to go up while you're moving around. It is when your overall blood pressure is high, even when you're resting, that you need to do something about it. So how is it measured? When you have your blood pressure measured, your reading is written as two numbers. The first is when the pressure is at its highest, or systolic pressure, which is when your heart beats. And the second number is at its lowest, or diastolic pressure, which is when your heart relaxes in between beats. Your blood pressure should be less than 130/80 millimeters of mercury if you have coronary artery disease. High blood pressure can cause heart and circulatory diseases, including heart attack or stroke. Most people get high blood pressure because of their diet, lifestyle, or because they have a medical condition. Drinking too much alcohol, smoking, being overweight, not doing enough exercise, and eating too much salty food are some of the causes. Sometimes high blood pressure runs in families and also can worsen with age. It's also more common if you are of Black African or Black Caribbean descent. However, even in these cases, you can still improve your blood pressure by changing your diet, losing weight, stopping smoking, reducing your alcohol intake, and being more active and taking medication. So just to go on to the things that we cannot change, there are a couple of things depicted here in the slide. The first one is the picture of the faces sort of progressing in age. So we do know that as you get older, this increases your risks of developing coronary artery disease. And it is more common as we get older. And it's obviously something that we cannot change. The other picture is the picture of gender, which is a picture of a man. And we know that men are more likely to develop heart disease at an earlier age than women, on average about 10 years earlier. And also there's a picture of the family tree. So we know that family history increases your risk, especially if it's associated with unhealthy lifestyles. So the image of the tree is to represent family history. If you have a family history of a heart or circulatory disease, you might have a higher risk of developing conditions that lead to a heart attack or stroke. A family history is a record of health conditions affecting your family members. Sometimes conditions can run in families. This means if you're related by blood to someone with a condition, you might be at more risk of developing it too. If you had a relative who had a condition but they've sadly passed away, this will also be recorded as part of your family history. A family history of a condition is caused by a combination of your genes and habits you share with your family. This combination can increase your risk. You have a family history of a condition if one or more of your family members you are related to by blood have it, such as your mum, dad, brother, sister, children, grandparents, aunt, uncles, nieces, nephews or cousins. You have what's called a strong family history if a condition has affected your father or brother under the age of 55 when they were diagnosed, or your mother or sister under the age of 65 when they were diagnosed. You can't change your family history, even if you want to, but you can reduce your risk of developing heart and circulatory diseases such as heart attack and stroke by not smoking, being physically active, having a healthy weight, eating a healthy balanced diet, managing high blood pressure and high cholesterol, and managing diabetes. Speak to your doctor or your cardiac rehab nurse if you're related to, by blood, someone who's had a heart attack or stroke, even if you feel healthy. They can check, the GP or your team can check your blood pressure and your blood cholesterol level. If they're too high, it may increase your risk of having a heart attack or stroke. Your doctor can help you reduce your risk of developing the same condition as your family member. They might suggest lifestyle changes or taking medication if it's needed. So if we now have a look at the image of the hands all joined together, this is to represent the differences between people and ethnicities, and evidence shows that cardiovascular disease or coronary artery disease is a leading cause of death nationally and in ethnic minority groups, causing 24% of all deaths in England and Wales in 2019. Studies in the UK and across the Indian diaspora, e.g. Europe, Fiji, Singapore, South Africa, the US and Canada, consistently show a higher incidence, prevalence and mortality from coronary vascular disease in South Asian groups compared with the white group or national average. South Asian groups have the highest mortality from heart disease and also develop heart disease at a younger age. As with heart disease, stroke incidence and mortality are also higher in the South Asian population. Cardiovascular risk, mortality is high and rising in South Asia in contrast to the declining trend elsewhere. The next image is of the baby being weighed. So this is to represent the fact that if a baby is of low birth weight, i.e. less than 6 pounds, This has been consistently associated with an increased risk for adult chronic disease, including cardiovascular disease, type 2 diabetes, and metabolic syndrome. So finally, misbeliefs about coronary artery disease, like the ones we've discussed, have the potential to affect quality of life and long-term health. Evidence shows that those who have a better understanding of their health have the following benefits as represented on this slide. They have an improved quality of life and health, they have less symptoms, less admissions to hospital, less anxiety, they feel more in control of their health, they return to a normal life, and they exercise regularly. So at the end of this slide, we've actually attached the cardiac beliefs questionnaire for you to have a look at and maybe test your family and to see what they think. I hope you found this helpful. Thank you.